Hi, this is going to be my story, just so you guys can get a little bit of a background in somewhat chronicle order. I know I've talked about various things in the last few videos, it was sporadic. So I wanted to just talk about some of the tests, procedures, surgeries, everything that I've gone through since the beginning of my undiagnosed chronic pain journey. I'm sure many of you have also went through this that I'm going to be reading, so I'm sorry if I look down. It's because I'm reading notes that I didn't want to forget. So, again, my name is Lori. I'm 45 years old. My pain started in 2010, so I was in my early 30s. Excuse me. So my pain started in 2010, early 2010. It started with very just like just back pain, but nothing ridiculous. I never had back pain in my life. Even delivered 3 children, never had back pain. So when I started getting back pain, I didn't know what it was from. I just figured it would go away. It's just from, I pulled a muscle or something. And then I started getting low pain that I called stomach pain. A spoiler alert, it ended up being pelvic pain. But I didn't know that. I just thought it was stomach pain because of the area it was in. And so this started a string of many tests, going to see many specialists. I did just about anything anyone would do in desperation to find out what's wrong with me and to get help, to be treated. And, I went through so much, I went through so much. It's been hell, excuse my language. Even to this day, I'm still in a lot of pain, but my pain's being managed to an okay degree. Let's just say that, because pain management doctors are very careful about what they prescribe, especially this day and age. They don't want to lose their license, and so me being undiagnosed on paper, it's like, oh, you're giving her this, you're treating her with this medication when she doesn't even have a diagnosis. And so it took me years. It really took me years to be taken seriously. But I did have a lot of tests and went to a lot of, excuse me, a lot of different specialists. So, and I'm just reading down. It started with my doctor, my PCP recommended I go see a stomach doctor, and they did the upper GI. They I did a colonoscopy. I've had many of those over the years, and so I did the upper and lower GI. Everything was fine. Nothing came back. So cross that off the list. I was also sent to a back doctor. Just end that real quick. Nothing. Couldn't help me. Didn't know what to do with me, basically. A lot of these doctors did not know what to do with me. Especially the PCP, the one that's sending me to all the specialists. At the end of the day, they don't know what to do, so they just keep sending me for this, that. So I've seen a back doctor. I've even seen a urologist. I guess because of the pelvic pain, I went to a urologist, got testing, everything was okay. You go through all these things and you want something to show up. Which is sad, you want something to show up on one of these tests because you want to know you're not crazy. Something's wrong with you and you deserve help. So I had many, blood tests and all that, multiple MRIs, CT scans, and then they sent me to an OBGYN for thinking maybe the low back pain and then the pelvic pain was somehow related, because they are parallel pain. The pain on my lower back and on my pelvis area is literally parallel, and then it's almost like they meet deep inside my body. But I also have a spine pain now, but that came when I got my spinal cord stimulator removed. It actually started after it got removed. And so that was ironic. So that was another pain. That's 3 pains that I deal with every day. Excuse me. But the one place that I just mentioned, the OBGYN, I was sent to a specialist there. Not just my typical office that I go for, girl stuff. I was sent to a gentleman. He was a specialist at McGee Hospital here in Pittsburgh. He said that I had, after he examined me, he said I had endometriosis. And so inside, I'm like celebrating. I mean, I finally have a diagnosis. I can't remember. I think this might have been 10 months into the pain, into my pain. So even at 10 months, I was thinking, yes, this is it. I'm going to get this taken care of, and I'm going to get my life back. I had no idea 13 years later that I would still be in this pain. In any event, he said, you have endometriosis, and we need to remove your uterus. And I was like, do what you need to do, doc. I mean, it's part of my womanhood. I knew I had 3 kids and that I most likely was not having any more children. My kids were 3, 5, and 9 when my pain started. So that in itself was very hard to cope with, being a mother, a single mother, in pain, and trying to raise these babies. I didn't want them to see me in pain, but they knew I was. In any event, I got the surgery, got my uterus taken out, and this is very weird. This is how well a lot of us women know our bodies. As soon as I was in recovery and waking up, I just knew I knew my heart, it was not successful. And I remember the nurses saying, oh honey, we're giving you pain medicine, and there's no way you could say that the surgery didn't help. You're having surgical pain. It was not. I know my body, and I knew it. I just knew instantly that it was not successful. And I was right, because guess what? I do not have endometriosis. I was diagnosed by a specialist, OBGYN, at a very well-known women's hospital, McGee Women's Hospital in Pittsburgh. I was diagnosed with endometriosis, recommended to get the surgery to get my uterus out, for nothing. For nothing, That was heartbreaking, It was just heartbreaking, mainly because I thought that was going to solve. I thought that after I recovered from that surgery, that, oh my goodness, everything's going to be better. No back pain, no pelvic pain, or at least relief of those. And then an answer. When he said I had endometriosis, I was just celebrating inside. And so that was difficult. That was the same year that my pain started. And so after that, my PCP didn't know what to do with me, okay? They did not know what to do with me because I had did every test, undergone surgery I didn't need. I mean, it was just crazy. We ran out of specialists for me to go see. I did physical therapy. I did chiropractor on my own time, my own money. I did acupuncture, which is expensive, lost weight. I did all these things that people like to suggest to you. When you have a chronic illness or pain or whatever, outsiders really don't understand. They do not know the extent, and I don't think they mean harm, but they'll suggest things, and inside you're like, you think I didn't try that already? Okay? It's very hard to even talk about your pain. Like, it's easy for me to talk to you guys. I'm nervous, but it's easy because I know anyone that's watching this can either relate, or they know somebody that's gone through something, whether it's cancer, chronic illness, even minor illnesses that affect your life. This changes your life. It changes your life because, number one, my pain dictates my life. Literally. I can't make plans. If I make plans and I wake up in pain, and I'll try my hardest to go. I will try so hard to go, but my pain dictates my life every day. Even though in this present day and age, my pain is being managed, better than it was when I first started pain management in 2012. So I've been in pain management for 13 years. My pain started in 2010. So it took about 2 years before I even seen a pain management person. And I don't know why I wasn't recommended before that. I had to go through so many tests and a surgery, a major surgery, hysterectomy, before I could even get referred to a pain management. And it was slow, it was slow. They didn't do much, they were very slow with me because, again, on paper, I don't have a diagnosis. There's no reason for this. So not only do I have back pain, I have pelvic pain. And they don't know where either of them are from. They don't know where they started from or what caused it. And living with that itself is very difficult. Living with the fact that you don't know what's wrong with you. Your doctors, like professionals, all of these specialists that I've seen, nobody can tell me what's wrong with me. And so, starting the pain management regimen was the best thing that could happen to me, although it's taken years for me to even kind of get to where I'm at now. And even now, I'm not on anything major. They're just giving me what they can without getting in trouble with the government and all that. And after all these years, why would I make up being in pain? Who in their right mind would go through all these tests and procedures for nothing? So I think the time amount, over a decade of being in pain, yeah, I think I would be approved for something stronger, but my pain management doctor, he's very conservative when it comes to stuff like that. He doesn't want to mess around with upping anything or putting me on an additional pill. When I go in and see him, he'll say, "How you doing?" And I say, "Stable." And so that's my word. He knows if I say stable, it means I'm in pain every day, but I'm coping with it. Because I would go in there crying many times, and I wasn't stable, and I would beg him, "Please help me. Please just get me stable. This is ruining my life. I can't do nothing. I'm a mother. I can't make plans to do anything," and I still can't to this day. Because if I do have the energy to do stuff, I tend to go overboard because I know that my pain is so unpredictable that I might not be able to get anything done in the next couple of days. So I do it all in one day, and then sometimes I can't sleep because I'm just in the middle of cleaning, and then I'm out the next day. Not always, but usually that's it. And they call that using one of your spoons. Let me know if anybody knows what the spoon theory is. It's basically your body saying, "I'll give you X amount of time," or etc. to get this done, but you can only use 2 of your spoons. I don't know how to explain it properly, but it's a spoon theory. It's just basically saying, here, I have 5 spoons, but after I use my 5th spoon, I'm done. That's it. And so, can't make plans, which is hard because I have 3 kids. They're older now, but there was lots of school events and stuff that I had to sit. And the thing about my pain, my low back pain and spine, is sitting just like I'm doing now hurts. The most comfortable position in life hurts me. And so I am in bed a lot. It's terrible. It's terrible being in bed. I have to lay on my left side. I don't know why. I think it's because I don't know if it's phantom pain from having the battery pack of the stimulator in my right hip, but it's more comfortable to lay on my left side. But if I lay down, any pressure on the spine is very painful. And again, this spine pain only started after I had my spinal cord stimulator removed. I had my spinal cord stimulator put in 2013. It didn't work. It wasn't successful. Didn't give me pain relief. And I want you guys to know I don't knock anybody going for that. I encourage it. If you think that it might help you, go for it. This is my story, and this is what happened to me. It just did not work. you know? And that was kind of like the end of the line for my pain doctors, because they had tried. I had, oh gosh, if I told you how many injections I had and over the years, it's crazy. I'd have to go back. Some of the names of the injections, not just trigger points, steroid, epidural, steroid, and facet, and there's so many out there that I had that I don't even remember. I'd have to go look years ago if my medical records show it, but I've had every single injection and not one of them worked. And so you could, and I almost felt like I was letting my doctors down by saying I didn't have relief, but I wasn't going to lie, you know. But every time I had to say something didn't work, I felt inside like, ugh, I just can't believe I keep saying that. I can't believe not one thing is helping me, you know. And I was being treated with, you know, pain pills, nothing significant, and not enough in a day. Because my pain is 24 hours, the amount of pain pills they gave me just was not enough for around the clock. And I went through that for many years. I was suffering bad because, you know you only have, say, 3 pills, and then you're thinking in your head, how long can I make one pill last? Because my pain's it's gonna start fading, the pain pill. And so just trying to maintain some quality of life. That's always been my goal. I just want quality of life. I want to be able to get up and do things. I'm not trying to do acrobats and stuff like that, but I just need to be stable. And so after all of those specialists, all those tests, all those injections, that's when we got to the spinal cord stimulator. And unfortunately, it did not help me. It didn't. You know, I knew it. We tried. It was a St. Jude spinal cord stimulator. That's the brand. And I worked with the representatives on you know, switching up different things, increasing, you know, this part of my back and this part of whatever, and none of it worked, you know. And that was another hard pill to swallow, so to speak. And so it's been very hard coping with undiagnosed pain. Any chronic illness, any chronic pain, cancer, anything is hard to cope with. I'm not special. I'm nobody. I'm just a person that got pain. I don't know how it originated. You know, I don't think I ever will find out what caused it. I don't think I will. It's been 13 years. That's hard to deal with. I don't want to get emotional. Just knowing that it's been 13 years of pain around the clock. So that has been very hard, you know, accepting that this is going to continue, you know, because I don't have anything to look forward as far as, oh, well, you know, in a month we're starting this new therapy and well, you think you're a perfect candidate. I don't have that. All I have is, well, the past 13 years have been like this, so I guess the rest of my life it's been like this. And so that's the regimen I'm on now. Is I'm on a patch. It's called the Butrans patch. If you don't know anything about it, just look it up. It's a 7-day patch. It's for people that are in pain around the clock like I am. And so I wear it for 7 days, and then I take it off, and then I put another one on. And I'm on another, it's not even considered a narcotic, another pill. It helps a little bit, but it's not a narcotic. It's not any of the popular ones or anything like that. And I'm on a very, very low dose of a muscle relaxer that really, you know, I don't know if it helps, and I tell them that. But I also don't know if it's harming me at all either. So I don't think there's a negative effect. And so we're continuing on that. So I'm on 2 different medications at the pain clinic, and then I'm on the patch. There's one more dose up on my patch, but my doctor is very funny. I think if I even mention going up to that dose, his reaction might be, well, Lori, what happens when that dose doesn't help? You know? he might be trying to keep me down here just to, as long as I'm stable. So, I don't even know if I want to ask him to raise the dose, because I'm scared too. I'm also scared that I'll become immune. And that's what happened with the pain pills, because I was on Norco, and Percocets never helped me. But I was on the Norco, and it helped for a while. But then it just was like, okay, it's been only 3 hours and I already feel like I need another pill. And so I wasn't prescribed enough. I wasn't prescribed enough for my pain, multiple sources of pain, and it's pain around the clock. So it's very difficult to have a plan of action for somebody that's in that situation. It's been quite a journey, and the journey continues. And so I'm going to stop rambling, and if you watch this whole thing, I want to say thank you for listening to me, because I don't think this video is really going to benefit anybody, but it's my way of saying I understand. Like, I'm not biased. I understand. I'm going through this. Would I compare myself to a cancer patient? No way. No way. We all have our own story and journey, Every day I tell myself, when I start feeling sorry for myself, I always say, Lori, it could be worse. And it could be worse. I could be dying. I could be having cancer. I could be having anything. But that does not negate the fact that I am suffering around the clock. And, I wish my pain was being managed more, but it is being managed to the point that I can go to the grocery store, do housework, nothing crazy. And I wasn't able to do that years ago. So, it took a long time to be on a regimen that's at least letting me do some things, Hopefully in the future my doctor will be open to try a new medicine or add something on, because the back pain is it's really torture. Just sitting here talking is torture on my spine and my low back. How I treat it, besides my pain management, I take lots of hot baths. I use a heating pad. Heat helps a lot. The heating pad, hot baths, and then I try to move my body as much as possible, because being in bed and stiff makes it worse. It's hard to get out of bed with pain, but I just push myself. I don't know how I've gotten through 13 years. This is like crazy, even talking about it. And so I just try to go one day at a time. That's all I can do. One day at a time. I have amazing kids. They've experienced all this. Grew up seeing me in pain, crying. I've tried to mask my pain because I don't want them to see it, but it's hard. It's painful, physically, emotionally, and let's not forget mentally. Mental health is affected by pain. If there's anybody out there that's in pain or chronic illness that doesn't feel like they have mental health issues, then good for you. In my case, that's not true. I already had some issues before all this, but this just kind of just blew everything up. So I would like to talk about, I mentioned this previously, I would like to talk about mental health, depression, and anxiety, which I suffer from both. And that the only reason I can even talk to you guys is because I'm looking at myself. I have very bad anxiety. And so dealing with all this depression, anxiety, and I also was diagnosed with diabetes. I didn't know I had it. And so I was diagnosed with that in 2017, and it was really bad. But now it's under control. I've come a long way. So I say I have a vicious cycle of health problems. I have my diabetes, I have my mental health issues, and then I have my pain. And if someone said put in order the worst to the last, well, first of all, pain is pain. It affects you. Mental health affects you too, but in a different way. Diabetes can kill you, right? Definitely can kill you. hate even saying that word, but um, I came close a couple times to you know, it was pretty bad. Even a year and a half ago, I was hospitalized because my sugar was out of control. My kids found me passed out on the floor twice. I didn't remember it. I don't know how it happened. I never passed out in my life before then. And so diabetes is part of my life. It's under the best control as it's been. I was on 3 different injections on top of medications. And so we've stopped almost everything. And I'm very proud of that. I lost weight and I feel better on that aspect. But it did not affect my pain, you know. Years ago, doctors would say, well, try to, you know, eat right, lose weight. I did that. That didn't help. I didn't think it would anyways. So, I think I'm going to just end this video now. Anybody that's watching or listening to me or can relate to me, can you please just leave a comment? You don't have to tell your story, but if you do, I would love to read your story and see if you can relate to anything that I've gone through. Or it doesn't have to be about my experiences. It could be your experience and what you go through every day or what you've been through and overcame. I would love to hear stories of people that had problems, maybe similar to mine or different, and somehow overcame them and they're good as new. I would love to hear the positive stories too, not just the negative ones and, you know, sad stuff, but that's reality. Talking about this stuff is good. I think it's like a form of therapy. But yes, if you've gone through anything major and you overcame it, I would love to hear the positive stories as well. But I'm going to end this now because it's very long. But thank you for anyone that's subscribed. You know, I appreciate it. I really do. I appreciate anybody watching my videos. You know, I haven't done videos in 8 years, so I'm just starting back up. And the main reason I didn't do videos all those years is because my pain was so bad. I never would be able to even talk like I'm talking right now. I'm in a lot of pain, but I can still talk and still think clearly. I couldn't do that for many years. So let's just end that. Okay, thank you for watching, and I hope you subscribe. Bye-bye.